Welcome, and thanks to all of you for, I was going to say dialing in today, but somehow dialing in doesn't quite seem like the right description when we're doing Zoom meetings. But for those of you who may be on the phone, and for those of you who are on computers, smartphones, tablets from all around the world, I want to take a moment to welcome all of you. My name is Josh Rednick, and I have the pleasure of serving as the Chief Development Officer for Hadassah, the Women's Zionist Organization of America. And on behalf of everyone in our philanthropy division, as well as the leadership of our entire organization, really want to take a moment to offer genuine gratitude, appreciation to everyone participating, not just for being here and for joining us for this opportunity to learn today with Professor Ran Nir Paz of Hadassah Medical Organization, but also for your ongoing support, especially during a time of real challenge and real crisis, not just in Israel and not just in the United States, but all around the world. Your support of HWZOA and of HMO allow our friends, really, our medical staff there, doctors, nurses, and many, many more, to save lives every day, even in what are clearly either unprecedented or hardly precedented circumstances. So today's an opportunity to continue what has become a series of Zoom meetings just like this, in which we have the pleasure of welcoming a friend and a colleague from HMO to come and talk with us about this novel coronavirus, COVID-19, how the outbreak is impacting Israel, all over the world, how HMO is responding to it. And when I say responding to it, I look at it through a couple of different lenses, including clinical care for patients who are being treated on our Ein Kerem campus in the historic Round Building, as well as research projects into new therapies, new medical equipment, and potentially even new vaccines that would prevent the further spread of this down the road. As I mentioned a moment ago, we're really thrilled to have with us on this call today Dr. Ran Nir Paz, one of HMO's leading infectious disease experts. So before I take a moment to introduce Dr. Nir Paz, I do want to offer a couple of sort of information technology reminders. At this point, I think everyone is probably accustomed to using Zoom or GoToMeeting or some variation of these video conferencing features. But I just want to offer a few quick reminders. One, we're using what's called a webinar format today, which means that you'll be able to see and hear from Dr. Nir Paz and see and hear from me, hopefully Dr. Nir Paz a lot more than me. But those of you who are joining us, you won't be able to actually ask questions and have yourself be heard. We're not going to turn your cameras on. We're just going to focus this opportunity on hearing from Dr. Nir Paz. We'll have the chance to have him address all of us. He's got some slides he wants to show us. We'll take a quick break in the middle, and then we'll have a Q&A section at the end of this call, like we always do, where we'll have a chance to do two things. One, take a look at the questions that you've already sent into us and have me present some or hopefully all of them to Dr. Nir Paz. And two, also take questions from you as an audience. And I do want to point out how you would raise a question during these proceedings. Down at if you're on a computer, down at the bottom of the Zoom screen, there's a menu, and one of the options on that menu says Q&A, and it shows these two little chat bubbles. And if you click on that, it'll open up a window on your computer and you can type your question in. And I have colleagues working with me that you can't see right now who are monitoring those questions as they come in. And we will do our best to prioritize them and put them in front of Dr. Nir Paz in the second part of our gathering today. Additionally, Zoom does have a fairly stable platform, but there could be moments when the video feed will freeze or the audio may go out a little bit. If that's the case, we have found Zoom to be pretty reliable, so please just give it a chance. Typically, things tend to clear up and resolve on their own, and we'll continue to move on. So far, we've had pretty good luck with that, and Kinahara, that won't put any kind of a curse on our call today. So let me tell you a little bit about who we're going to be hearing from today, because again, it's really a pleasure to have Dr. Nir Paz with us. This is an individual who's been at the forefront of the fight against COVID-19, really from the outset of the outbreak. As I think some of you already know, Dr. Nir Paz recently came out of quarantine in Israel following his return from a trip to Japan, where he traveled to treat Israeli patients who had come into contact with the virus after being on board a Diamond Princess cruise ship. This was a story that made headlines all over the world, and Dr. Nir Paz was literally and figuratively right in the thick of all of that. Since that time, he has begun working on clinical trials for treatments of COVID-19. He really was the first Israeli doctor to encounter the virus in person during that trip to Japan. So the question of how to treat this disease and to control its spread have really been on his mind, and we'll have an opportunity to hear more about that. He has a new study that is now underway that is demonstrating, hopefully, both the safety and the efficacy of combining multiple molecules, multiple drugs into one type of a treatment. And at some point during today's presentation, he'll have the opportunity to share a little more information with you and with all of us, really, about how he plans to proceed with that. Just a little bit of background, because Dr. Nir Paz was doing all of this great work well before any of us had heard of COVID-19. After graduating from the Hebrew University Hadassah Medical School, he did begin his career at Hadassah Medical Organization. It's where he's been working for quite some time now, we are proud to say. Currently, he serves as a senior physician in HMO's Microbiology and Infectious Diseases Department. He also has a research lab, as evidenced by the project that I mentioned that he's developing. And his research interests include, among other things, the epidemiology, the origin, and the spread of various infectious diseases. So with all of that said, I want to take a moment to formally welcome Dr. Nir Paz. Again, we're really thrilled that you're joining us today. Thank you really, not only for taking the time to speak with us, but for all of the good work that you are doing under the banner of Hadassah, because we take great pride in that. So for now, Dr. Nir Paz, please take it away.
Thank you, Joshua. Thank you very much for these warm words and a nice presentation of myself. It's always better that somebody else is doing that for you, because generally people say little about themselves. So thank you for that. If possible, I would like to share with you just a second. I would like to share with you a presentation that I've made, and apparently I've just pushed the wrong button. We'll fix that in a second. Perfect. So here it is. And that's it. Just can you just confirm that everybody sees it the right way?
Dr. Nir Paz, you may want to switch to that full slideshow view. There you go. You were one step ahead of me. Thank you.
Yeah, perfect, lovely. So now we can continue. So I've got this running presentation since I've been to Japan. So flying from Israel to Japan is a long way to go. And initially I took it the long way. I flew through London. And on the way back, I realized that the one most important thing that I should do when coming back is just prepare a presentation, because probably one guy or two guys or quite a few people would like to hear about the COVID-19 and what's going on. And ever since, which is now almost 2 months since my return, I've got this presentation which is being updated regularly, and you could see through the presentation what's going on. I've made it quite short because I don't want to get into too much technical stuff, but let's try. So obviously I'm here. I'm coming from the Hadassah Medical Center. This is the big campus from the west side. Our department is somewhere around here. It's very complicated to show. It's just the other direction, but it's just over there. And I took this from a different project that we do, because generally what we were doing is in the last few years is playing with phages, which are viruses against bacteria to cure chronic infections. And this is just a famous case that we have used that was published practically a year from now. And while just before going to Japan, we were in the middle of increasing the number of patients that we treat with phages, but then COVID-19 came and we switched gears. So you already heard those from the news. Those are just public media figures that I took from several sources. Now, what we're dealing now is a disease called COVID-19. I don't think we've ever had a disease with such a strange name, and it's being caused by a virus called SARS-CoV-2, which is also a strange name for a virus, but for whatever it is, those are the names that we use those days. It's an RNA virus, and it's a family, it belongs to a family that can cause either the common cold or some kind of more severe diseases like SARS or MERS. And the one thing that we encounter through all the times is the numbers that we use from time to time. And people compare, as my first infectious disease had told in Yiddish, people compare chazer and lokshen, or apple and oranges. And people compare numbers in different countries, and those numbers in different countries just behave differently. If we take, for example, Germany, Germany is one big country that try to measure all of the positive cases, while, for example, United Kingdom just measures the tip of the iceberg. So comparing UK to Germany, or for example, New York to California, is not an easy thing and not straightforward thing, because each one measures different things, and therefore it's complicated to compare all those numbers. And the other thing we need to remember is that we're dealing with a very interesting virus. This is taken from the New York Times. It's just to show to us what are we dealing with. So on this axis, it's the number of a virus can infect, an infected person can infect. And initially we thought the number that a virus can infect is between 2 and 4, but recent papers suggest that the number of people infected from a positive person can start at the number of around 6. And then we go for the other side of the figure, which is the fatality rate. How many people are being killed by percent from this virus, and there's a range, and the range is quite important, and the range is because it's depending in which country are you. If you're in a country in which the medical resources are not exhausted, then the mortality rate is rather low. But if you go to a country in which the medical resources are exhausted, for example, Italy, then the mortality rate can be quite high, up to 3% of the infected person. But take in mind that the way people count the numbers can be different. So what's the situation of Hadassah as of today? We've seen at Hadassah close to 300 patients since the beginning of the epidemic in Israel, which is about a month ago, a bit more than a month ago. Unfortunately, we have 11 patients who have succumbed to the disease. We currently, as of this noon, we had 52 admitted patients. 20 of those were in ICUs and close to ventilation or ventilation. Most of them were ventilated via invasive ventilation, few were with non-invasive ventilation. And we have plenty of clinical trials going on over there. I just named a few, and I'll go through those. We've got the Avigan clinical trial, and I'm proud to say that probably we are the first country out getting this drug out of Japan and doing a clinical trial with this drug. With the story of getting this drug is in many ways like a good James Bond film of how to persuade Japan in a good way to give us Hadassah, in particular, the drug, and then while there's no air traffic around the globe, getting the drug from Tokyo to Israel. And we started this study last Thursday, and we enrolled the first patient, and it's just the first patient, so we can't tell much, but we hope to have up to 160 patients in this study, and hopefully to have some meaningful results out of it. It's a promising drug, initially developed by Fujifilm to deal with pandemic flu. There's two IL-6 receptor antagonist studies going at Hadassah. One is with Actemra, the other one is by a different drug company. We have another study, a phase 2 study with a drug called selinexor, very interesting drug. It's a multi-center FDA authorized study. A few of the centers are in the States, few in Europe, and obviously a couple of centers in Israel. We have a center of using apoptotic cells. This is a drug that developed in Hadassah, and hopefully going to be used to show that it's do some benefit to patients. We have plenty of practically plenty of studies. Some of them are industry, but many of those are investigator-initiated, meaning the whole support for those studies coming from inside funds of Hadassah, just to try to make this work better. Approved today at the Ethics Committee, the WHO-sponsored Solidarity study, in which we hope to join in or join forces in a couple of weeks. In Israel, the number of patients is going down because of the lockdown that we had, but Israel was opened partially today, so we do anticipate an increase in cases soon. I would add to that, although I didn't wrote it over here, there's a few other projects that we are deeply involved with, and those regarding how we should model and plan for opening the country, and whom should be get out of the lockdown initially. And those projects belong are in one of those is in the School of Public Health, which is Hadassah, and we just published a few days ago the ability of letting kids go back to school. It hit the news quite widely in Israel, and it's a very important paper, I think, because it just summarized that kids are probably quite safe with this disease and could go back to school, at least kids up to the age of 10 or 9. The other thing is a model that we created with the people from the physics department in the Hebrew University, in which we modeled how a lockdown should be managed and what should be anticipated. And this was discussed by the cabinet of Israel to try and see whether we can influence and get things done. And we were complimented by quite few people from the cabinet and other important organizations that apparently our model was the most comprehensive and straightforward model for getting out of lockdown. Just for getting the numbers, those are the numbers of today noon, and we can see that apparently the USA is the country with the most cases up to now and with the most death. In this slide, there's plenty of countries. Israel just about here. Just remember, I came from Japan, and at that time there were 700 cases in Japan. Now Israel passed Japan. Japan is 130 million. Israel is just 9 million, and there's plenty more cases in Israel than in Japan. In this slide, there's plenty of other countries, and we need to bear in mind, as I told you, those numbers are not really comparable. And apparently what we figured out in the model that we created, that the way to go is to compare countries by the serious and critical cases. And you can see the variability over here, because we understand that those are the patients that you can measure. Those are the patients will be presented to the medical system and would be tested. And therefore, if you use this parameter, you really can compare different countries to one another. And we won't get to that anymore just over here. And we need to understand countries are different because of different measures. If you just compare mortalities, this is just taking from the Financial Times, and you can look over there about the blog on the COVID-19. It's a very good blog. You can see that countries behave differently. And there's a lot of parameters that put countries in the different positions over here. We just need to bear this option in mind. And obviously the accessibility to medical sources is one of the major and most important things. The more medical resources there are, the better ability of the country to manage this outbreak. So one of the things that was debated initially, and I think a few officials in the US spoke about that, is what should be done, how should we protect ourselves? And this is just about the physics of how infectious diseases infect. And we've heard a lot about aerosols and droplets and whatever it is. And the important thing to remember is that a pathogen that is being transmitted by droplets will go fast down, and a pathogen that's being transmitted by aerosol will stay up in the air for quite a long distance. That's the one thing that we need to get in mind. And in COVID-19, the things that are being infected are the upper airway and the lungs at the most. There are also involvement of other organs, but we won't touch with those. And the most important thing is this take-home message. Masks are important, and we think that the difference between the countries in East Asia, mainly Japan, but some other countries, from countries in the West, is the use of masks, which is being used over there for over 100 years because initially of the influenza epidemic, the Spanish flu. So we need to bear in mind that when we use masks, even when we use surgical masks, and when we walk around, we protect ourselves by the multiplicity of the protection of the surgical mask, by the person protecting yourself. And if you are infected and you mildly have a mild disease and you don't know that, or even asymptomatic, you prevent the transmission and reduce it up to about 10%, which is a large number. If you use better protected masks, if those are available, obviously you're being protected better, but those masks are hard to be used. You need to know how to use those, and therefore those masks are being used by the medical personnel who is there treating the COVID-19 patients. The other thing that we need to bear in mind, and this is just about science, how beautiful science can be, that when you look on the genomics of those viruses, they started in the East over here and went through to the States and all over. They created some genetics changes with time, and you can practically know the whereabouts of your virus from its genetics and know the origin from which it came, from which location it came to Israel or to a different place, and how it spread within a community. It's really a cool tool to look at things and just in many ways provide to us the beauty of how things are going around. The other thing to bear in mind regarding this disease is that it takes a long time to get rid of the virus. We get ourselves starting our symptoms about 5 days after we got the virus from a neighbor, family member, or whatever, we got it. Then the trick is that we need to bear in mind that there's practically a couple of stages in the disease. The first stage is the mild one. It's the one that we are not afraid of. It's about 7 days and everything should be going fine. Few of the patients after 7 days will develop a more severe disease, which will result in some cases in ICU admission. And this is the kind of disease that we are afraid of. If you got a good medical support, then probably you will be able to go out of it unless you are old or have medical issues in the background. The total duration of a person that can spread the disease, spread the virus, is about 20 days since he got the symptoms. It means that we are practically able to spread the disease for about 22 days. That's a lot of time. Generally, we don't see that with infectious diseases, and especially with viral infectious diseases. There's obviously a few exceptions for that, but that's what makes the issue with this disease. This is another figure to suggest that. So we have this asymptomatic period of about 5 days. Then we have the symptomatic period that can vary from few days to 12 days. Few of the people will get cured over here, but still will be able to spread the virus. Few will get to a more complicated course of disease, will get to the ICU, and out of those, about 30 to 50% will die. The guys who get into the ICU are the guys who are possibly gonna die, and the rest, it will take time, but they will cure. What about treatment? We need to bear in mind, we don't really have a good protocol for treatment of this virus. Whatever we do is purely experimental. We have hints. We have a lot of medical knowledge coming in, and there's plenty of protocols. Most of them are research about the use of hydroxychloroquine plus or minus azithromycin, which was the hype, but now is considered not needed. There was a hype around Caletra, then there was the paper in the New England that practically suggested that it's not effective. There's the hype around remdesivir of Gilead, which I'm a bit of skeptic about it, but I won't get in too much into that. And there's the favipiravir, the Avigan, the drug that we got from Japan, with some very nice results from China. And I've heard just the other day that there's some nice results also from Japan regarding this drug. So we are really optimistic about it, that we'll get something out of the trial that we do. There's the anti-IL-6 receptor drugs like the Actemra and Kevzara. Both trials are in Hadassah. The favipiravir trials in Hadassah. We're gonna get the solidarity, so we're gonna cover most of those drugs as well. And one can see all the ideas why each drug should work, but obviously life are more complicated, and what should work does not necessarily work. But the one other important thing that we need to bear in mind is the suggestion that convalescent plasma from patients who were cured from the disease can help in fighting the disease. We don't really know if this works, because there's a suggestion that the prevention of disease or the immunity from disease doesn't come from antibodies, but rather from T cells, which make this also a more not straightforward. So I thank you very much for your attention. This is my Twitter if anybody wants to follow. Generally, when I'm not on duty, I try to tweet something. And obviously you can see over here the picture of the Diamond Princess while I was over there in Japan, driving from Tokyo to Yokosuka when we had 2 patients over there. So you just drive through and can see the Diamond Princess ship just before everybody got down from it. And I thought it's kind of nice to picture the ship just behind the bars to exemplify that it's forbidden to go over there. So thank you very much for your attention. And Joshua, back to you.
Okay, we're just gonna wait for Dr. Nir Paz to turn off screen sharing, and then we will continue on. While Dr. Nir Paz is doing that, actually give me just one sec. There we go. We're back to where we were. So thank you so much, Dr. Nir Paz, for all of that information. As you might imagine, questions were coming in pretty quickly in the chat and the Q&A, by some email and by some text. So we're going to do our best to organize that. I do want to take about a 1-minute break just to cover a couple of key points. One, just a reminder that the only way for us to convey questions to Dr. Nir Paz is to flow them through our team. So feel free to raise them in the Q&A or in the chat, and we will do our best to address them. A really important point for me to make, though, is just to take a quick moment to step back and remind all of us of 2 really important points. One, this is as we've said already, virtually unprecedented time, really historically speaking. But the work that doctors like Ran Nir Paz are doing, along with many others, nurses, doctors, and many others in Israel, is clearly not only treating the patients who are in need of great care right now at our hospital in Israel, but also pushing the envelope forward on hopefully better therapies, possibility of vaccines, and much, much more. I do want to point out that in order to provide all of that good care and to conduct that research, simply put, it takes resources. And we know that all of this is happening to all of us. It's taking place in Israel, it's taking place here in the States. And any of our fundraising efforts as an organization are unfolding at a time that is incredibly sensitive, scary, anxiety producing, and a whole lot more, not to mention the fact that all of us have seen the ups and the downs in the capital markets over the last couple of weeks in response to this pandemic. But at the same time, our organization has shown unbelievable love, support, and much more to our friends and our hospitals in Israel, and importantly to the patients who are cared for there for well over 100 years now. That's the history and the legacy of our organization, and it's also very much going to be the present and future of our organization. So as you continue to have opportunities like this to learn and take pride in the work that our colleagues there are doing, we certainly hope that you'll consider supporting the emergency fundraising efforts that we are engaged in right now. Just as a reminder, the Round Building, which was vacated in preparation to be renovated as part of our First Circle campaign, has now become literally the epicenter of care and treatment for COVID-19 in Israel. There's an ICU that was built out. If you had the opportunity to join us for the call, the Zoom meeting with Professor Sigal Sphiri, about 2 weeks ago, you had an opportunity to see some visuals on just what that looks like. And again, this type of work and the ability to respond in times of crisis and emergency, it simply doesn't exist without the support of people just like you. So I will thank you in advance for whatever support you can provide. And I'll also harken back to something that a colleague of mine and a donor to our organization, Susan Shakura, mentioned the last time we were on one of these Zoom calls, which is that it's not just an opportunity to support an organization that you love and care about, and the people who are going to benefit from all of that treatment. It's really an opportunity to be a partner in saving lives, a partner to doctors just like Dr. Nir Paz joining us today. So with all of that said, I want to move on to our Q&A session. We've got about 25 minutes left in this call, so ample time to get through a lot of questions. And I want to start, Dr. Nir Paz, with a question that actually just came in recently over the Q&A section here on Zoom. And that is that we've heard for a while now, those of us, I was going to say those of us who are following this closely, but I don't know a single person who's not following this closely at this point. We've been reading stories about the fact that individuals can be asymptomatic, but can still have the virus. And they just may not be showing any evidence of it themselves, but they can have it. And importantly, they can be contagious and they can transmit it to others. And I wanted to see if you could share with us, and you were showing some charts about this, but I wanted to just bring it back again and have you speak to this issue, because the question did come up. If you know roughly how long the virus will reside in an asymptomatic person's body, and maybe give us one more reminder yet again of what it is we can do to protect ourselves. And I'm pulling out the mask that friends of ours have made, that we've been wearing in our family on the few occasions that we've had to leave the home and go to the grocery store and things like that. So if you could talk to us again a little bit about asymptomatic carriers, roughly how long the virus will tend to be in their body, and another reminder again about how important it is to protect ourselves.
So asymptomatic carriers is a very interesting issue over here. So unlike viral diseases, that when you start a disease, then you just don't spread it around and you get to be spreading the disease when you're really sick, so you stay at home or being admitted. So this disease is kind of different. You start to be probably spreading the disease a couple of days just before feeling anything. So that's one type of asymptomatic spreading the disease. In some people, it's just a few hours before. In some people, it's a day before. But this is one type. The other type is those people who are practically hardly sick. The only thing that they would have is just change in smell or change in taste. And they might have a mild fever for 24 hours or so and nothing more than that. And while that, they could be spreading the disease around. So those are the major two types of the disease. The other type of disease spreaders of asymptomatic spreaders will be those who are having the disease for few days, couple of days, and then will be feeling quite well and will go outside and could spread the disease for additional, I'd say, a week or so. The median time, meaning half of the time that half of the people spread the disease will be approximately between 12 to, I'd say, 18 days. In some cases, longer. So when you have this time, it takes a lot of time for people. I've seen quite a few people who took them, for whom it took about a month to clear spreading the virus, while they felt quite good and quite well. For example, the Israeli people, the 4 people that were on the Diamond Princess ship, none of them was really symptomatic. One lady had a cough, another had a mild fever, and that's it, 4 of them. And all of them were quite elderly. All of them were above the age of 70. So even older people can get the disease quite mild. If we get this by numbers, then we estimate that about 40% of the people who get the virus will be practically either asymptomatic or extremely mild symptomatic, and conceived by most of them that they are not having a real disease. And this is the major issue that makes this disease spread so nice within the community. The other 40% will have some disease that they will know and they will feel and they will stay at home, and only the rest, the 20 or 15 less, 20 or 15% of the people will have a disease as such that will need either admission, and only 5 to 3% of the people of the total number will be in serious condition, and some of them will be also critical. So the main issue with this disease is that a major portion of the population will get it very mild. But what we do is just to preserve the people who will need medical attention, which is also a quite large number of people.
Great, thank you. In addition to wearing masks and taking other steps, one of the questions that seems to come up a lot here in the States with regard to protecting yourselves is whether it's safe to be ordering food and having it be delivered to your home, or other those kinds of things. Are there steps that you suggest beyond potentially what CDC guidance is or WHO guidance is, steps that people can take to make sure that in an effort to provide for their families and simply get a meal, that they're doing even that in the safest way possible?
So if you want to go to the safest way, then the safest way is just to have the grocery, either to go to a safe store when there's plenty of distance between people and buy the food over there, and then cook your meals your own. That's probably the best time to improve your cooking abilities, to have a good cookbook, maybe the Israeli style of cooking, and start cooking at home. And that's probably the best way. Obviously, ordering food from other location is good. We don't have too much information about getting the disease from food, but obviously cooking the food at home from produce and groceries that you bought will be the best way to go.
Got it. Okay, thank you. So I want to move on a little bit from what it's like for people to be able to protect themselves to some of the issues you were sharing with us in your presentation about the development of new therapies and the testing of it. You were good enough to talk with us a little bit, really answering one of the questions that was raised before the call, which had to do with drugs that are currently being used to treat patients at HMO. And you clearly stated the fact that there is no one therapy that is necessarily working for all patients right now, that there's a lot of different things that are in the mix. One of the questions that tends to come up about biomedical research in Israel versus biomedical research in the United States is the pace at which Israeli researchers are able to move, because there's a belief, right or wrong, that the regulatory environment in Israel is different than it is here in the United States. And so I'm curious if you could take us a little bit more behind the scenes of the life and mindset of a researcher working in Israel with regard to questions like about how long you think it might take to get a new clinical trial off the ground or to develop a new molecule, what it's like to potentially bring something like that to market so it becomes a more mainstream treatment for people with this virus all over the world. Do things really move more quickly in Israel down that path of discovery compared to a country like the US or maybe other places around the world? Give us a little bit, again, of what the mindset of an Israeli researcher is like, thinking about those kinds of issues, and whether you believe that work being done in Israel right now might be able to, for lack of a better description, be commercialized or go to market that much more quickly.
So I think that's a tough question in many ways. If I'll take, for example, the Avigan, the favipiravir that, you know, when I was over there in Japan, I sat to dinner with one of my Japanese colleagues that I knew before, and then we discussed this epidemic, and we discussed what they treat over there, and then how I got to know this favipiravir drug and to see whether it makes a difference or not. And since the moment that I've encountered this guy and spoke with the ambassador, the Israeli ambassador to Japan, that I want to bring it to Israel, until we got it, there were, I think, up to 8 weeks, which is quite, for me, it looks like ages. I understand that we were the first to get it out of Japan. Still, 8 weeks is a long time. So, but I think it's all about the drive, how passionate you are about your idea and to bring that into reality. I don't think there's really big differences in time if you're passionate about what you do. And I take, for example, from a great colleague of mine from San Diego, Chip Schooley, who is also the editor of Clinical Infectious Diseases. And when he started over there, the phage therapy, and he was just pushing that because he was passionate. So he was speaking to FDA, getting all the clearances, and they were able to treat the first patient. So I think that if you're passionate and you know that you need to fight the system and make things going, then it will go. Still, it's all about how to go and how to fight the mechanism. It's always, in many ways, in Israel, to maybe easier to fight the system because the country is smaller and know people here and people there, and you can speak with those, and if they know you, they will make things go a bit faster. But sometimes, you know, it just takes time, and we don't have the FDA that you need to approve for pre-IND that take 30 days to get something going. But even with the FDA, if you speak with them and explain well why you need that going, I think they will hear you. We know that in this COVID-19 there were issues with, for example, the test in the USA, and obviously there was some hurdles that people couldn't go through, but I think that the main issue is just to identify the hurdle and to fight it. And as long as you don't fight it, it will take time. And if you fight for your time, you'll get it done. I think this is the main difference. And sometimes even in the States, people fighting for things and things are being done quite fast. And we can see that just, you know, when the issue of Plaquenil, the hydroxychloroquine came out, then it took quite a short time, and plenty of people in the States created really nice clinical trials that we hope to have some nice results coming out this weekend, as I heard in the blogs and in Twitter, and we'll get a very important information out of it. And the other thing that you didn't ask for it, but I'll say it anyhow, another very interesting issue with this epidemic is the epidemic of information. We have a huge amount of information coming out, most of it in non-peer-reviewed journals, and you need to find the right thing or the good things of what is going on over there. And one of the most wonderful tools that we have is Twitter. amazingly so. There's an article coming out, non-peer-reviewed, and you can get all the critics out there in Twitter. People do go and by their name, putting all the critics outside, and you can read it and you can learn from it, and you can read critics about this model and that model. And I think in many ways, this pandemic taught us also great things on how maybe we should consume scientific information.
Got it. Thank you very much. It sounds like whether it's Israel or whether it's the US or anywhere else, part of the battle is the actual conducting of the science, if you will, and part of it is how you relate to the regulatory bodies and the people you know there in order to continue to speed things along. I would guess in that way, it's not unlike getting anything else done in the world, even if this task is that much bigger and there's that much more that's on the line right now. We talked a little bit about looking at various drugs that could be used by themselves or in combination with each other in testing new treatments, and you and your team are going to be looking at one of those. You are looking at one of those combinations right now. Let's transition for a quick second to this whole notion of antibodies, because over the last couple of weeks, speaking anecdotally, I know I've seen the news coverage pick up on any number of stories about patients who have had the virus, have been treated, fortunately have had their treatment been successful, been released from the hospital, and then are being asked to donate blood or serum, whatever part of the bodily fluid it is. I'm not a doctor, that other doctors would be able to look at and see if antibodies were developed. And to what degree is there real legitimate hope or belief that in those antibodies, researchers may be able to find the origin point of a vaccine or a different kind of treatment or something else along those lines?
So in fact, you touched here a couple of things which are extremely interesting. First is the topic that we called passive immunization versus active immunization. Passive immunization, we know for more than a century, that can work for many infectious diseases. It was being done, it was tested, and we used it for treatment for many diseases for many years. It's you take antibodies from one person, concentrate and use those antibodies to treat an infectious diseases. It was done for hepatitis B for many years and for many other diseases as well. Even for polio in a few decades back. So passive immunization is antibodies that being taken out of the plasma of a person who was infected, and we concentrate those and we can give those to people. So that's the main issue behind the treatment, that the cured person is being asked to donate plasma, and the plasma is being given to other people. The trick here is that we know that in about 30% of the people, there's no antibodies being detected, while those people got cured from the disease. That means that we have another part of the immune system that deals with this disease in us. And the trick here is to understand what is this immunity, how it's being done, and to use this part of immunity to create an immunization, what we call an active immunization, to be used. This is the trickiest part, and it takes time. We don't really know how long it's going to take, but we hope it's not going to take too long, because unless we get all the population immunized, we can anticipate that this disease will go on and on and on and still infect people all around us. So the strive to find active immunization is the most important one. The other thing that relates to that is when we have a population in which the disease is actively going on, like let's say in the Bronx, for example, or White Plains, or whatever you'd like in the area of New York, and you want to know how many people got infected over there. So you can do a survey and take antibodies and take PCR swabs from everybody and see who really have the virus at a certain point. Nevertheless, you don't know how many people got cured. And the way to measure how many people got cured is by measuring antibodies. The trick here is that we don't really have a good test for antibodies yet available. And thus it will be also hard for us to understand the extent of people immunized, even those 70% that get antibodies. Sometimes it's tricky to understand what is going on. And indeed, there was this nice paper, not yet peer-reviewed, coming from Stanford University. I think the first author was an Israeli guy, looking about the seroprevalence in the Santa Clara County of people who got COVID-19. And there was a big debate over there in Twitter, as I suggested, whether this study is valid or not, and what are the margins of error. You should interpret those results with the margins of error and everything. Nevertheless, whatever the critics are, those authors should be applauded for what they've done, because it's a very nice attempt to understand the extent of disease within a community.
Great, thank you. I want to move back, because we've got a few minutes left, to a couple of more what I would call practical questions, more along the lines of what I raised about ordering food and how to protect yourself and things like that. One of the questions, and again, I'm referring back to what some of us at least are seeing in popular media, one of the questions and one of the interesting things that keeps coming up is whether or not the weather has any impact on the survivability of this virus. And as you know, here in the States, as things begin to warm up, now that it's spring, moving into summer, will the ability for the virus to proliferate start to go down? Similar questions have been raised about the fact that, you know, much of the outbreak is taking place in countries that are north of the equator, as opposed to south of the equator. And as everyone on this call knows, currently south of the equator, the seasons are the opposite of what we're experiencing up here north of the equator. So I'm wondering, in addition to that, if you also have seen some of the reporting over this past weekend about sunlight's ability to kill the virus perhaps more quickly than was originally thought. So put all that together, if you would: weather, geographic location, sunlight, and more, and talk to us a little bit about your understanding as an infectious disease expert on how all of that functions.
Okay, so I think there's a few answers for that, and what I start with is that it's not something that we have a good scientific evidence to support any statement that I'm going to say or anybody else is going to say. But I'll start with just a couple of facts. We need to bear in mind that the COVID-19 is apparently infecting quite nicely also in the southern hemisphere. There's a large epidemic in Brazil. There's a large epidemic in Peru. Part of the countries in East Asia are in the southern hemisphere, and the disease is still going on over there very nicely. And I'm not sure it's nicely, but it's still going on quite extensively over there. Also in Singapore, which is equatorial, there's a big surge over there, and actually it's not the weather and it's not the sun that makes a difference over there. The other thing that we need to bear in mind is that the fact that we put a lockdown on a population will reduce the ability of people to get infected. So we'll get a reduction in the number of infected people. And then summer will cool down, we'll release the lockdown, and we'll say, oh, it's summertime, that got numbers to go down, but it was not summertime, it is lockdown. So I'd suggest that based on the knowledge that we have at this stage, it's really difficult to suggest that summertime will make any difference. It's not behaving like flu, for which summertime do have a difference, but we know already that in pandemic flu, summertime can not prevent the disease. So I'd say that we are not protected from summertime. It's all about how much lockdown and opening lockdown will make a difference. We do anticipate a second surge. Whether this second surge is going to be in July or in September or in November, we don't really know, because that's about social distancing and putting masks and other measures that we now apply to prevent us from infecting ourselves. So I'd say that we might see some changes, that could be interpreted related to seasonality, but it probably will have so many more other attributes that makes these differences.
Thank you. I want to squeeze in one more question before we wrap up, because we want to maximize our time with you today, Dr. Nir Paz. This is, I would imagine, a really difficult question to try to answer, but it's something that's on everyone's mind, particularly as they hear somebody with your expertise talk about the possibility of another spike in cases in July, September, November, or at any point in the future. And that is there any way to try and get our arms around how quickly a vaccine can be developed, which would prevent potentially another spike down the road if people were able to be given that vaccine at some point in the future?
That's a lovely question. So part of what we've done here in Israel is to create some working groups. We have a Twitter working groups trying to find solutions for a lot of things, practical things and non-practical things. And one of my colleagues from one of those groups created a quiz for when should be or when will be a vaccine available. And I try to follow what the WHO suggests, because they have the most plentiful information about what's going on. And they suggest it's somewhere around from a year from now. And I estimate that those numbers are true. Nevertheless, this one guy told me, listen, it's going to be, I don't remember the exact date that he told me, but somewhere around September, I think 17th of September. And I told him, that's an easy one. I can do a bet from you on a Corona beer that I'm going to win. But I think if we get that into some reality, obviously, the first trials for the virus, the safety trials, probably will be sometimes around summertime. We don't really know what's going on. If we're lucky, then we'll have some phase 2 and phase 3 studies starting around November or December, not before that. The people you need to vaccinate, you need to make sure that everything is fine, you need to make the production, and production currently is problematic because of the lockdowns. So I'd assume that if we are lucky, then vaccines should be be available somewhere around a year from now or a bit before that, but not earlier than that. And hopefully that will enable us to go to some kind of the life as we knew it for the next year or so. Life is going to be completely different.
Got it. Okay, thank you so much. I want to just close by offering really heartfelt thanks to you, Dr. Nir Paz, not only for joining us for today, but for all of the work that you're doing, really for all of us, for all of our behalf. That's what biomedical research does. It's not just for the people where it's taking place, it's a benefit to humanity, which is another wonderful reminder of how we conceive of ourselves as an organization and the great work that we do as Hadassah on behalf of humanity. A couple of quick things as we wrap up. One, we did record today's Zoom meeting, and we will make that recording available. Once we get it from Zoom, we will ultimately post it to our website, and you'll have the ability to go back and rewatch this or share it, or however it is you would want to use that content. The second thing I would say is just to thank you all again for taking time out of your day to come and join us, and hopefully have a chance to learn something new and be reminded of the import of all of this work, as well as what's taking place at Hadassah in Israel. With all of that said, I really want to thank Dr. Nir Paz one last time, and we will bring today's session to a close. Please be on the lookout for email communication from us with a posting of that recording, and we will see you the next time that we host a call just like this. Thank you so much.